Hey everybody, welcome back to my channel. Today I will be talking about the favorite treatment option of eye doctors, that is eye drops. I will be talking about some of the do's, some of the don'ts, and some of the important aspects about how they should be used. So please stay tuned. Whenever you are using any eye drop into the eye, the first thing to always do is understand why you are using the eye drop, what condition you are trying to treat, how often you should be using the eye drop, and when you should be using the eye drop. All of these things will help you to understand your condition better, and therefore if you understand your condition better, the motivation to use the eye drops will be far greater. The basics of using eye drops should be thought of in terms of the basics surrounding when you would otherwise eat food. That involves sitting in a clean place and environment, washing your hands thoroughly and drying them with soap and water, and then being in a relaxed environment where you can carry out the treatment for your eyes. There are several different ways to instill eye drops. As the saying goes, there are several different ways to skin a cat. The safest and best way that I find to instill eye drops, and I deploy this method myself, is by using a mirror. The way I do it is I look into a mirror, I get close enough to it so that I can see what I'm doing. I then will pull my lower eyelid down. I then will squeeze the bottle or the tube, and I will pop one drop on the inside of my eyelid. I will then gently close my eye, and voila, the treatment is done. Other patients are naturally gifted, far more so than I am, and they're able to instill eye drops without actually using a mirror, and they tend to do this quite effectively. But I just find it a bit uncomfortable going anywhere near my eye with any foreign object, basically. If you are a carer or a family member that is going to be instilling drops into somebody's eyes, then it's best to ask the patient to sit and relax, to arch their head back slightly, and then similar to how you would instill drops into your own eye, you would ask the patient to look up, which would move the cornea out of harm's way. You would then pull the eyelid down and again squeeze a drop into the inside of the eyelid. One thing to mention before actually instilling the eye drop is to always check that you have the correct eye drop for the correct patient. You are about to instill it into the correct eye, and always check the batch number and expiry date, because time does fly by and you would be amazed as to how frequently patients use out-of-date eye drops. Another useful thing that you can do yourself, or if you are instilling eye drops for somebody else, is to place a tissue just beneath the eyelid on the cheek, which can help to catch any stray eye drops. It's important to remember also that the bottle within which the drops are contained, or the tube, has a nozzle on the end. The nozzle should never come into contact with the eyelid. Ideally, it should come close to the inside of the eyelid, but not actually touch it. After the drop has been instilled into your eye or into somebody else's eye, it's best to gently close the eye, to gently have a few blinks, and if the outer aspect of the eyelid has become damp during this process, then the tissue can be used just to dab the eye dry. At the end of the procedure, you would then wash your hands and store your drops as advised to do so. If you have been advised to use multiple eye drops as part of your treatment regime, then it's usually advisable to instill one drop, to wait approximately 3 to 5 minutes, and then to instill the other eye drop after. Another thing that tends to come up is if patients have shaky hands, they feel that they may not be able to accurately pop the drop into their eye. If the context and scenario can vary, so if the shakiness is on one side, then the other hand can be used to stabilize the shaky hand, or the other hand itself can be used, but that will also depend on preference and whether somebody is right-handed or left-handed. In the shaky hand context, that individual may ask for assistance from a family member also. Some patients also have arthritis in their hands, which means that they may be unable to mechanically squeeze the bottle or the tube in order to get the drop into their eye. It's very useful in such contexts to speak to your local pharmacist, because they do have these fantastic contraptions available these days which can assist in such difficult contexts and circumstances. It's very important that you do discuss any potential issues that you may have in instilling any eye drops either into your eye or into the eye of a family member, because ultimately your eye care professional will have prescribed these drops to be used to manage a certain condition, and if you're struggling to get these drops into the eye, you won't be managing your condition as intended. If you feel that you will be unable to instill these eye drops into your eye, it is crucial that you have an open, frank and honest conversation with your eye care professional so that they can factor these things into their decision making, because if you will struggle to get these drops into your eyes, and the options of trying to aid you to get these drops into your eyes will not be beneficial to you either, then other treatment modalities and options will need to be considered. So please do have these discussions very early on. That brings me to the end of this video about eye drops. I hope you have found this video useful. If you have done so, please do hit the like button, hit the subscribe button if you would like to see further content from myself. If you have any suggestions on future videos, please do comment below. Thank you so much for your time. Thank you so much for watching. Take care.